Hello, my name is Paul Della Ripa. I'm a rheumatologist and physician at the Brigham and Women's Hospital in Boston, and I'm happy to speak on the effects of climate change on patients with lupus, systemic lupus. These slides and this presentation was made in cooperation with Dr. Marissa Savoy and Dr. Thomas Bush. Here's some resource information that'll help people in keywords looking at where more information can be obtained in this regard. Here are the learning objectives for this presentation. To number one, understand the symptoms of systemic lupus, activity and plausible environmental effects on immune mechanisms in lupus, to describe associations of fine particulate matter, pollution, heat exposure, and climate change on lupus activity, and to identify health disparities in lupus care and how this may be exacerbated by the climate crisis. Finally, to discuss practical patient counseling regarding ways to protect against extreme heat, sun exposure, and particulate matter. Lupus is a multi-system immune-mediated disease that can affect basically every organ in the body. This can be severe, such as with lupus nephritis or CNS lupus, or less severe manifestations such as mild skin disease or joint pain. But when flares occur, any organ system can be affected. You can have low-grade fevers, photosensitivity, oral ulcers, joint pain, joint swelling, systemic or constitutional symptoms like fatigue, pleuritis, pericarditis, and other vascular manifestations of disease can occur associated with SLE flares. The immune mechanisms associated with the development of lupus or exacerbation of lupus are not completely understood, but SLE pathogenesis is basically related to abnormalities in both the innate and adaptive immune systems. Increased concentrations of autoantigens related to increased apoptosis and impaired clearance, leading to loss of tolerance of both B cells and T cells, which can lead to the proliferation and development of inflammatory cytokines, including IL-17, IL-10, and also increased interferon production, which can lead to end organ damage. A variety of environmental factors, such as pollution, fine particulate matter, can lead to apoptosis and then activate T cells. And it's thought that extreme heat can also play a role on B cell function and cytokine expression. The development of our understanding of where risks exist and how we might hypothesize how exposures to environmental factors may increase risk is still in its infancy. This one study done through Johns Hopkins, Stogan and al. Looked at a spatiotemporal analysis of symptoms in a large cohort of patients within a certain radius of their Hopkins clinics. And in a univariate analysis, temperature was associated with rash flares or joint flares and hematologic flares. Spatiotemporal analysis is an emerging method to understand the relationship of environmental exposures and disease flares and manifestations, but nonetheless is a challenging process and method at this point. In another study done in Taiwan and Quebec, which was a population-based cohort, Young and al. Looked at air pollution concentrations and found a positive association in terms of long-term exposure to CO, NO2, and PM2.5 with an increased risk of SLE with exposure to these elements. So the questions really are twofold. Do environmental exposures increase the risk of flares? But also, does environmental exposure also increase the risk of developing underlying disease like lupus or other autoimmune diseases. Climate change may worsen health disparities in lupus. So we do know that severe racial disparities exist in care for patients with SLE. Black patients have a higher mortality than white patients, and patients in marginalized healthcare communities are at risk for climate events. We obviously feel that community partnerships and resources will need to be considered in patients with limited resources in areas that are exposed to extreme heat, wildfires, or flooding, or other manifestations of climate change as we move forward. Patient counseling is important as the duration of cold weather shortens and patients have increased sun exposure. This could lead to increased photosensitive rash, and patients need to be reminded of the importance of protection against the sun, emphasizing hydration during heat waves, staying indoors, and being aware to avail themselves to cooling centers if they don't have air conditioning. Patients with renal disorders, such as lupus patients with renal manifestations on medications that are excreted renally, will need to be monitored more closely. And if feasible, patients who are exposed to high levels of pollution, either related to wildfires or other manifestations, will need to consider the use of HEPA filters and N95 masks and limit their time outside, especially if they have underlying lung disease. And in addition, there are some references provided, and I thank you for your time. Thank you.